So the childhood illnesses, the most common cause of childhood illnesses in most parts of the world, including the British Virgin Islands, are still infectious diseases. I'm sure most of us are familiar with that. It's quite simple. And the two most common type of infectious illnesses we see in the Caribbean and the BVI, mainly are the respiratory infections, and I'll call them the second group, the gastrointestinal infections. Now, in the respiratory infections, you could have a chest infection, you could have a throat infection, you could have an ear infection, and some of the kids, especially who are prone to wheezing, like the asthmatics, when they get this kind of infection, they tend to wheeze a lot, and that could be a problem. For the gastrointestinal infections, the most common one is the gastroenteritis, whereby they either vomiting and they have diarrhea. And I put in bracket hand, foot, and mouth. I'm sure everybody has been hearing about hand, foot, and mouth over the past, Hand, foot, and mouth is actually it's quite common in most parts of the world, especially in the European countries and in American countries. Over the past couple of years, it's made its way to the BVI. And it's something we're seeing quite often nowadays, okay? And if you have any questions about that, I'll come back to that later on. All right. So the most common causes of these infections are usually viruses. Viruses are the most common causes. Hand, foot, and mouth is actually caused by a group of viruses, not one particular kind of virus. I just want to digress a bit. And it's so common that it's not unusual that kids may have 2 or 3 episodes within a cycle, because it depends on what kind of virus is circulating that is causing it. And of course, we have the bacterial infections. I put there in particular strep. In Canada recently and in North America, which is also could be a problem here, they've been talking about the walking pneumonia, which is caused by a particular common organism, which is actually quite common, but it was all over the media, but pediatricians are aware of it anyway. Now, I want to focus a bit more about prevention, which is mainly the aim of my discussion here. The most important way of preventing most of this infection has a lot to do with hygienic practices, because most of them are spread by direct contact. Hand washing in particular, when it comes to particular hand, foot, and mouth, because it's really spread. Either they go to the daycare, they take care of the child has a pool, they clean the child, then the carrier goes to the next person without washing their hands properly, and then it's spread to the next child. Barrier measures, and most of us knew about COVID, where everybody was wearing masks, so it's kind of straightforward. Isolation practices, to a point, they may help, especially when you have children in a daycare setting and you isolate one child so that that child does not spread the infection to the other children. So it's kind of straightforward. Now, the big one is vaccination, and I think one of the challenges we have in most parts of the world is that there's a lot of anti-vaxxers out there. Unfortunately, COVID did not help. A lot of people got worried about COVID and all that has to do with it. But when I started training in pediatrics, there were certain infections that were so common that it used to be a big problem in caring for children, and some of those kids actually had fatal outcomes. In Trinidad, we had children who were born with significant infections which could have been prevented. Measles, we heard about measles coming back. So I'm here to kind of appeal to everybody that we don't want to go back to the era whereby we had a lot of infectious disease amongst children, and vaccination plays a key role in preventing that. I know a lot of people have questions about vaccinations and stuff, but I think it's something we ought to do. And this is the current BVI schedule, really, and it's actually quite straightforward, and it's similar to most parts of the Caribbean. And I'm sure all of you have the book, and you go to the health center, they fill the books. But it's pretty straightforward, and it's designed primarily to protect children from most of these infectious illnesses. All right? Any questions so far? Pretty straightforward. Okay, any questions? All right, next slide. Now, this is where I'm going to spend a bit more time. There's been a lot of discussions about autism in the social media. People have read all kinds of things about autism. Some say autism is on the rise, some say there's an epidemic of autism. But what is actually autism? Intentionally, it was changed. They stopped calling autism, we now call it autistic spectrum disorder. And it's to make people understand certain things about the condition. So one of the simplest definitions I found is this. a lifelong developmental condition affecting how the person communicates, interacts, and experiences the world. The key word there is a lifelong condition, and it affects the way they communicate with their surrounding, essentially. And it's called a spectrum now because it affects people in different ways and in various degrees. So you can have what we call, people don't use such terms again, high functioning autism, all that. People don't use those terms, but they just define what the issues are with the person and make a diagnosis. It cannot be cured, okay? Because essentially, it's how their brain developed, essentially. Then nothing can do about it. It has no known cure at this point in time. Their brain just works differently. And this is important when we're dealing with children that have autism. Next slide. Now, what causes autism? What causes autism? I intentionally put that there because there's a lot of stuff on media, social media, regarding things that pertain, that might be causing autism. The simple answer is nobody knows. Nobody knows at all. At times, there are some genetic conditions that at times are associated with autism, and at times that's why in certain families, it tends to be seen in certain families. But as to why it's causing it, nobody's so sure. There's a lot of research looking at environmental factors, what it plays in how people develop it, but the jury is still out there. So autism is not caused by vaccination. Is everybody shocked? Sorry?
Mainstream news just this morning has been saying that they're tracing autism to mothers using Tylenol during pregnancy.
I'm happy she said mainstream news.
Yeah.
You know, people are looking into everything, but vaccination is not the cause of autism. The story about vaccination was rather unfortunate. I was training in England that time, and there was a doctor who did research looking at the measles, mumps, rubella virus. And it basically said, it felt that the children who were being given this particular vaccine, that they found quite a lot of the bacteria within the stomach, sort of a part of the virus within the tummy of the children who have autism, and it made what they call a causal relationship. And unfortunately, in those days, people used to, the way medical research is, nowadays that doesn't happen again. But the information was published in the medical journal without being called peer reviewed, and it caused a lot of unnecessary controversies. And over the years, they've actually disproved that research, and there's been no evidence to suggest that causal relationship. But the cat has been let out of the bag. Trying to pull it back is a problem. And the problem with that in particular, measles is on the rise again. And a lot of children are dying in the States and everywhere because of things like measles. So vaccination is not a cause of vaccine. It doesn't cause autism. Infections don't cause autism. It's not because the parents are bad, because that's another thing that used to cause a stigma, because people felt my child is autistic, was I doing something wrong as a parent? And a lot of people do not seek help because of the stigma associated with that. So it's not caused by bad parenting. And there's no diet association. It's not the food you eat, it's not whether you take zinc, or you see all sort of stuff in the media. And unfortunately, people have preyed on people's vulnerability to capitalize on that. And there's a lot of things out there, people are buying stuff which makes no benefit to the child. Any questions so far?
Not a question, it's more of a comment.
Okay.
Just to emphasize your point, because we have a lot of debates and discourse in our group about this very.
Can you hear? Let me give you the other microphone.
Thank you. I just wanted to say thank you for underscoring that particular point. because we have a lot of debate and discourse even within the lemonade community about whether or not to vaccinate your child. The research that the good doctor just referred to has absolutely been debunked. And I just want to take this moment to say to you as a parent of an autistic child, 2 children, both of them vaccinated. My daughter's autism was not caused by vaccines, okay? I don't know, well, we know that we have theories as to why mainstream media might be saying some of these things, and I heard Kathy's comments about Tylenol in pregnancy causing autism. They're reaching. No one knows what causes autism. There are some commonalities in there. There's the genetic factor that's in there. But to say that you're a bad parent, or that your family is cursed, or there's a demon in your child, and all these things you hear in the community, is wrong, and it should stop. And that's what's bringing shame in our community and stopping families from stepping up and helping their children. So that's what I want to say to you today as parents. If you have a concern about your child, you're not a bad parent. Do not hide your children away. Do not hide your families away. Bring them out, get them the help they need, because then they have the right, just like the rest of us, to be contributing members of society.
Thank you. Thank you. And I said it's very important we get this. Next slide, please. So the question is, and it's a relevant question, why are there so many cases now in the community? Everybody's saying, oh, we are having people being diagnosed more. And I'll try and explain it, but it's not an epidemic. What actually has happened? Years ago, the diagnosis of autism was very, very restrictive. But over the years, research has actually, there's no blood test or any test to do for autism. It's actually, they looked at criteria, there's a criteria, and they've expanded the criteria, which has essentially captured much more children or much more people that otherwise were not captured before. So that's one reason. The second reason is people are becoming more aware that, listen, you know what? We can actually, there's something going on with my child, I need to seek help. And the tools for assessment have become much more available and they are much more sensitive. And the other big factor is the fact that it's improved access to screening and diagnosis. Before, in the past, maybe there had been only one doctor in the whole region that can, or one person that can make the assessment. But now you have more people that can make the assessment, and people can easily access those services. And also the other issue that a lot of screening is actually now done in schools, and kids can actually be picked up and referred for assessment. So it's not an epidemic, it's just people are now becoming more aware. So the cases that we're not aware of, we're now being aware of them. So it's not an epidemic. Next slide. So what are the challenges in looking after an autistic child, be it or autistic person, be it a child or an adult? And I'll just mention some of the common ones. They could have feeding difficulties, and a lot of parents struggle with this. Some might just eat very little, some might eat just a particular thing, and some might eat just quite a lot. And it could be quite a challenge. And some, because of their issues, could have choking problems, and constipation is a big problem for some of them. Okay? They could have sleeping difficulties, and the reasons for that vary. It could be because they're quite sensitive to light. They could have ADHD, which is associated with this. The use of smartphones, laptops is a big problem and could actually cause sleeping difficulties. So even for children, generally speaking, I encourage families to have a regular sleep hygiene and curtail the use of smartphones and laptops because it can impair with the sleep cycle. Of course, the big one, they could have difficulty socializing. And their behaviors, they could have serious meltdowns, and they could be verbally abusive, and parents could struggle with a child who is exceptionally physically aggressive. I once had a child I looked after in the UK, basically destroyed the section of the ward that the child was in. They had to close that section. It was autistic. You know, it could be quite a challenge. Next slide. Of course, educational challenges, and social services and education play a key role in supporting children who have autism, because some of them, not all of them, some of them might require specialized input. They could have a specialized plan, what we call an individual individual education plan, and much more might be required to make sure they can function effectively. There are a lot of autistic children actually exceptionally intelligent, but they have to be given the right tools and basically nurtured in the right environment to bring out their abilities and their gifts. And of course, the healthcare challenges, which are numerous to speak about. So how do we manage those challenges? The key thing for most autistic children and autistic adults is they usually have this problem, especially the meltdowns and their behavior challenges, when they feel there's a loss of control. And loss of control could be as a result of if there's a change in their routine, they can't understand it, and they just flare up. They could be unwell or they could be in pain. So basically, it's just support. And the support most of the time is a multidisciplinary support that involves education, social, and health services, and it involves many categories of people. Okay, just give you an example there. Any questions so far? Okay, all right. Next slide. How am I doing so far with time? Am I speaking too fast? Okay, all right. So this is the last topic I'm going to speak on, mental health challenges in children. What is mental health? It's just simply the overall awareness of how we think, manage our feelings and behavior. And the mental health disorder essentially just speaks to the fact, the patterns of change in thinking, feelings, or behavior that causes distress or gets in the way of being able to act appropriately. Now, for a child in particular, they're disrupting their ability to do what they need to do, causes problems both at home, at school, and in social setting. All right? So it's very important to understand that the child is a bit more, it has different environment that child operates in. Next slide, please. How does it manifest? The child could just be quiet for no reason. And it doesn't matter what the age of the child is. And at times, many a times we don't recognize, especially as the community, that a child who has gone quiet suddenly, is there something wrong? They could just withdraw from everything. They could be having sleep difficulties. And some kids in particular, they start doing poorly at school. And that's a problem. And of course, feeding difficulties. And what are the causes? I listed some causes here. Autism is a possible cause, ADHD, attention deficit hyperactive disorder, eating problems, depressive problems, illicit use of drugs. Next slide. But I want to focus on this one in particular because at times, this is the one that at times most people do not pick up. What we call the post-traumatic stress disorder in children. And there are various causes of that. One of the most common causes is the child is being bullied. And the child doesn't do well at school, doesn't tell anybody, is afraid to tell anybody because the child is being bullied. Any form of abuse, be it verbal, emotional, physical, is a problem. If a child who has suffered bereavement in the family, if a child is in an environment where there is domestic violence or has witnessed any form of violence, and this is becoming a problem more and more in those societies, the kids are in a home where there's domestic violence, and the only way you might actually know about it is the child being withdrawn or the child does not want to go home, is just withdrawn from the environment. One of the biggest ones I've seen in Tortola, because we're a very migrant society, we have children of families who have come to work here, and those kids are not doing well at school. The parents come and tell me, oh, the child is not doing well at school, or they don't understand why, and there's no problem. The child is basically suffering from being relocated from where the child was familiar with, and it causes a problem. Of course, anytime you change schools, there's that potential problem that can happen for children. Any questions so far? Any comment? Jackie, any comment? All right, next slide. So how do you promote wellness? And it's pretty straightforward. I'm sure people have been talking about before I came. It's just basically doing the things that we do well, we do it well. regular exercises, good sleep hygiene, balanced meals, taking care of yourself, going on vacations, and building good social connections. The church plays a big role in that, community groups, and if need be, seek professional help. A lot of people, many a times, are reluctant to seek professional help, but it's something that people should do if need be. And I think that's the last slide. Thank you.
We know that where you choose to bank matters, and it is your vote on what your funds do in strengthening our community. As your official Bank of Paradise, we invest and support the lifeblood of our economy by helping in the realization of personal goals for homeownership, education, and entrepreneurial visions, which support small businesses. We make it our place to connect with persons and worthy causes, and we have been doing so for more than 30 years. Where your money goes and what your dollars empower are your choice. And we thank you for choosing us, a bank that gives where it matters the most, for you, for our community, and a happier tomorrow. The National Bank of the Virgin Islands.